Okay, so this is your letter. Let's see how it is. Department of Thoracic Medicine, Smithtown Hospital. So, okay, so there, the very important thing to remember over here is you are not going to write Mr. over here, okay, because the age of the patient is less than 15. So you will just
Yeah.
write James Smith, okay, and there should be comma over here as well. I mentioned this in the basic class as well, okay. I'm writing to refer again. There should be no Mr., no Smith. You just have to write the first name whenever the age is less than 16. So it should be James. I'm writing to refer James, who has presented with acute respiratory symptoms. Okay, so this letter is not about uh, presenting complaint. Okay, here you have treated the patient. Okay, patient presented to you with recurrent respiratory tract infections due to cystic fibrosis. You have treated the patient, and now you are sending this patient to a surgeon for double lung transplant. Okay, that is your purpose. So
Okay.
how would you write the purpose over here? It's not a simple referral letter. Okay, it would become a transfer letter or a referral plus discharge letter. Okay, whatever you prefer writing, you can write. Let me tell you how you can write that thing. Okay, so you have to write, I am writing to transfer James, who has treated for recurrent respiratory tract infections due to cystic fibrosis. Your further assessment and management, including a possibility of double lung transplant suitability, would be appreciated. This is the simple thing that was mentioned inside your written task as well. Okay, you just have to copy paste few of the information and mention over here. Okay, that's your purpose. It's
Should I have
okay if
to
you
mention here that
that what
I'm asking, should I have to mention this in the purpose? Like I'm writing to transfer James who has presented
yeah, yeah.
with recurrent infections
Yes, because this is
and
your
about
purpose.
lung
Yeah,
transplantation.
yes,
Yeah.
that's the demand. Okay, that is the demand. Okay, you know how to write the purpose. Okay, reason demands. I told you. So how would you, what is your demand? You're demanding the surgeon. Okay, you are demanding him to actually, if there is a possibility for the lung transplant, then he should do it. Okay,
Yeah.
so that's your way to write the purpose. It's okay to make mistakes. I mean, it's just second, third letter, so you will eventually understand what I'm trying to explain on daily basis. Okay, now let's move further. On this state, again, it should be James, so I'm not going to point out this mistake now. Okay, James presented with severe dyspnea, coughing, hypoxia, hemoptysis, fever, and headache. His examination revealed O2 SAT. There is no SAT, O2 saturation, okay, or O2, that's it. Okay,
Okay.
either skip this one or write the full form. Increased breathing rate, erythematous oropharynx, and on further chest examination, sonorous wheeze and bibasal crackles were found. See, there's when you say his examination, so his examination includes everything. It's not about chest and abdomen and this and that. Okay, so you don't need to specify that you have heard wheeze, okay, on chest. I mean, the other person also a doctor, is a surgeon, thoracic surgeon. He knows that wheeze is in the chest. You can't hear wheeze in abdomen. Okay, or bibasal crackles in there. So just some few of the things there is no need to clarify further. Okay, rather than you have to react a little smartly. Okay, He was commenced on ampicillin. Ampicillin is a generic name, so you will have to write A smaller. Ampicillin, sulbactam, and supplemental oxygen. He was commenced on ampicillin, sulbactam, and supplemental oxygen was attached. Okay, or you can even complete your sentence over
Okay.
here. There's no need to write attached or something. On the state, again, James reported improvement and further investigations were done. His chest X-ray showed pleural effusion and pneumonia, while CT scan remarked chronic sinusitis. Acceptable, no problem. Okay. Therefore, he was commenced on azithromycin, azithromycin 500 mg and ciprofloxacin. There should be add. Remember the linking word I told you. Okay. It's better to write. Therefore, his medication was changed to azithromycin and ciprofloxacin because previously you were giving or he was taking ampicillin. Okay, now things have changed. Okay, today James is medically stable.
I have a question, doctor. Do I have
Yep.
to mention?
Mention what? Sorry. Hello. Sorry, I can't hear you. If you're speaking something. Can't hear you. Hello.
It was mentioned in.
See, it's completely up to you. If you want to mention it, you can mention. If you don't want to mention it, there's no problem with it. But using so many brackets are never preferred. Okay. For example, you're mentioning here 30 breaths per minute and increased breathing rate. Okay. So either specify it in a way that his breathing rate was 30. Eventually, the reader will understand that it is in higher ranges. Okay. Same goes for here, chronic sinusitis, paranasal sinus. There's no need to mention this one. See, as I mentioned, there is no need to overly explain things. Okay, because if you read the official writing criteria, they mention that you have to write a letter in a very concise way. Okay, they never asked over explanations. Okay, so if you want, you can write it down. Okay, and do not add brackets though. Okay, if not, then just write he was commenced from azithromycin and ciprofloxacin. Okay, no problem, both are fine. But if you want to mention, avoid adding more brackets. It's okay to add few of the brackets, but when it is required, not everywhere. Okay, today James is medically stable. There is no now. Okay, James is medically stable. It is itself a complete sentence. And to ready to be discharged. It is a better sentence. Okay, with the assistance of his family. Okay. Supervise his physiotherapy and self-care activities like diet and exercise. See, you're now ending your sentence over exercise, and there is just a comma over here. This is what I mentioned last time as well. Use the linking word. There should be and to complete it. If there are three, four things, then you can add one comma and one and that's fine. But if you're ending your sentence just after one word, just write and to complete it in a better way. Please note that James has cystic fibrosis. Okay, James has cystic fibrosis since 2006. Therefore, a poor growth. Therefore, poor growth what? See, again, there's no need to overly explain. Just 2006, it's fine. He has symptomatic focal epilepsy and history of chronic sinus infections. Meanwhile, he has a healthy diet but overweight and no allergies. If there is something, if there is no allergies, there is no need to mention it. Okay, just write. You know, this information could have been skipped except this. You can mention the weight category, and that's fine. But other things can be skipped. This paragraph was uh, somehow poorly explained and poorly written, but that's okay. Now let's just focus on the other thing, the other thing, the other thing. Okay. Okay, where were we? Okay, Miss, it's not okay. Again, it's not James. Sorry, it's not Mr. Smith. It's James. Has family history of lung cancer. Again, his father. This is over explanation. And mother has history of rhinitis. In view of the above, I would see this last sentence was difficult to write. The last paragraph. So if I'm not wrong, I do not have the case notes at the moment, but whatever I can recall, it was mentioned inside the case notes. If you see that there is a discussion that has been made with the parents and the James that there's increased likelihood of infections, decreased time in school. All of these things were explained to James. You skipped everything, and that was important to mention. Okay, that is the relevant information. So you have to write in the discharge plan. Today, James is medically stable and is ready to be discharged. Okay, a discussion regarding his increased frequency of lung infections, decreased time in school has been or have been made with him or his parents, whatever was mentioned. I cannot exactly recall that. Okay, and then you can keep on writing whatever was mentioned inside that. Okay, in 2 3 lines. Then comes the history and the conclusion. So the history will be written after that, and it should be written in a single paragraph. So you have to write, please note, James has been diagnosed with cystic fibrosis since 2006. Okay, he also for which he takes regular medication. Okay, because there are so many medications mentioned, cryon, pulmozyme. Okay, if I'm not wrong, these were the medications that were mentioned inside the case notes. Then you have to write that he also has a focal symptomatic epilepsy and chronic sinus infections. So you can just mention these two things. So or either you can combine them and mention that, please note, James has cystic fibrosis, focal symptomatic epilepsy, and chronic sinus infections for which he takes regular medication. This is also a similar, simple way to write it down, which is also fine. The next would be about the family history. So you have to write his family history is positive, or he has a significant family history of lung cancer and rhinitis. There's no need to mention mother is this, father is that, no problem. Okay, there's no need to
Okay.
overly explain things in order to get the right or appropriate information. You just have to give the history. You're talking about James, you're not talking about his mother or his dead father. Okay, so that's it. Then you can write, in view of the above, I would be grateful if you could further assess and manage James accordingly, and then obviously the last part. Okay, so this is overall you have to mention. Okay, these were the mistakes. That's why I didn't explain it yesterday. I had to take a class for you until you are not writing a proper letter. Once you are done with writing a very good fine letters, then we will just have a conversation on a voice notes or simple text messages, because then I'll just read, I'll tell you this is your mistake, and we'll move forward. We will not waste time on taking lengthy classes. But as of now, you are making some mistakes, so I have to explain them to you. Tomorrow, we will talk about speaking. Okay,
Yeah.
I want you to write one more letter. Okay, but we will, if there are mistakes, then we will evaluate the letter day after tomorrow, not tomorrow. Tomorrow we'll talk about the speaking part. I've already sent you the basic lecture, so you have the access. Okay, you can